Hi guys, and welcome back to another ECG video on sqadia.com. Now, if you haven't seen our video on ECG basics, I suggest you take a look at that first so that this video will be easier to understand. Now, electrocardiographs or ECGs are very difficult to learn, especially because there are so many different findings that you could find. This video will take you through the most commonly asked ECGs that you should be familiar with and be able to recognize. Now again, there are many different ways to approach ECGs, but this is the simplest way that we would recommend. First, we look at the P waves, and then we look at the rhythm. Next, we look at the QRS complexes, and then we move on to the intervals, and then finally the ST segments. First, we look for the P waves. From the video on ECG basics, you should be able to recall what a P wave looks like. Now we see if the P waves are present at all. And in a normal setting, P waves in a sinus rhythm originate from the sinus node. P waves will be visualized before a QRS complex. Next, we'll take a look at the rhythm. Is it regular or irregular? To determine this, we look at the long lead and look at the distance between the QRS complexes. This is a regular rhythm, and an irregular rhythm shown here where you can see irregularly placed QRS complexes. Next, we look at the QRS complexes itself. Are they wide or narrow? A narrow QRS complex would be less than 120 milliseconds or 3 small boxes. This indicates that the His per Kunji works normally and there are no bundle branch blocks. In a wide QRS complex, it is usually due to a bundle branch block in stable patients, or in ventricular rhythms, which are QRS complexes generated by the ventricles. Next, we take a look at the intervals. A normal PR interval is less than 210 milliseconds. A prolongation is due to an AV block. And then we look at the QT intervals. This can be prolonged with decreased calcium, as well as with antiarrhythmic drugs. And the QT interval can be shortened with an increase in calcium. And lastly, we look at the ST segments. The T waves are inverted in ischemia. The T waves are peaked in early ischemia or hyperkalemia, and they appear flat in hypokalemia. ST depression is seen in subendocardial ischemia, and ST elevations are seen in transmural ischemia. So this was just a basic overview. Keep watching so that we can learn more about how to interpret ischemia, AV blocks, atrial fibrillation, flutter, and ventricular fibrillation, as well as some other findings that are commonly found on ECGs.